So further continuing our topic of ectopic pregnancy, we left at the definition of ectopic pregnancy. So the patient now knows that she has ectopic pregnancy, and you have assessed the patient's knowledge. Now it's your turn to give information to the patient. The first step whenever you are describing a condition to the patient, whenever you are giving information to the patient, is to ask the patient if she would or he would like to know about the condition. Okay, you can ask the patient here, in this case for example, that do you want me to explain it to you? Okay, would you like me to give some information to you regarding this condition? And she will. In PLAB2 situations, these patients, they do say yes. Okay, and then you describe this condition in as simple words as possible. Okay, for example, we can say that, so an ectopic pregnancy means that a pregnancy grows outside the uterus, which is the womb. Okay, this is the place where normally pregnancy occurs. Now, what happens when a lady becomes pregnant is that the sperm and the egg, they meet in the fallopian tube, that is the tube that carries the egg from the ovary to the uterus. And usually this fertilized egg moves into the uterus so that the pregnancy has room to grow and develop. If this normal phenomena doesn't happen, that is, if this fertilized egg fails to move on to pregnancy, and it begins to actually develop within the fallopian tube, okay, this is what leads to an ectopic pregnancy. And this ectopic pregnancy is sometimes also called tubal pregnancy because it occurs in the tube. So a tube is basically the most common place where this pregnancy occurs, and this is what has happened in your situation as well, because she also has a tubal pregnancy, the patient in PLAB2 scenario. An ectopic pregnancy can occur in places other than a fallopian tube as well. For example, it can rarely occur in the ovaries, which are the egg-producing glands in our body, in a female's body. Or very rarely, it may even develop inside the abdomen. Okay? Whenever you're giving information to the patient, make sure you don't give too much information at the same time. Now, I have described to the patient what an ectopic pregnancy is. I have to make sure that the patient is following me. Okay? It's not that I'm just talking and the patient gets bored and loses interest and it's too much information for the patient to take at one time. So I've described to the patient, I'll give a pause and I'll ask, are you following me? Do you want me to repeat anything for you? Is that okay? Should I continue? So these are different ways of basically making sure that the patient is following you. Okay? And she's getting the information that should be given, basically. Okay. Next thing you need to tell her now, with empathy, with sympathy, that a pregnancy cannot survive in this situation, sadly, and it cannot lead to the birth of a baby. Okay? Unfortunately, this pregnancy, that is the tubal pregnancy, cannot lead to the birth of a baby. This is because as the pregnancy gets bigger, it can run out of space to grow within the tube. Okay, you know that the tube is very narrow as compared to the uterus, and so it will run out of space. And what eventually will happen is, if the pregnancy continues to grow, the tube may burst, causing internal bleeding, causing severe pain. And this, when happens, that is when the tube ruptures, when the tube bursts, it is a potentially life-threatening situation for the patient. Okay? just to give you some stats, basically, they say about 1 in 85 to 90 women, they have ectopic pregnancy in UK. So basically, the chances are just over 1%. So if you want to mention it at any point during your explanation, you may. Okay, it depends on you, basically. So we define the ectopic pregnancy here. Now, before we go deep into more information and talk to her about the treatment, basically, which is going to be our focus in this station, we have to ask the patient. Okay, we have explained to you what ectopic pregnancy is. Now, is there anything the patient in particular wants to know? Because this is what happens sometimes when you're given an information, a new piece of information, suddenly some questions come into your mind, right? And you want to ask those questions immediately. So you need to ask the patient, okay? Is there anything specific that you want to know before I give you more information? Okay, is there any question in your mind? Is there any query that you want to clarify with me? If she says no, which she will most of the times, then you proceed on to giving her more information. Okay, but it is very important to always ask the patient if she or he has any question in his or her mind. Okay, one of the favorite questions of the PLAB2 patients is that they ask you, why did it happen to me? Okay, why me? Basically, it means that you need to explain the various causes, why the ectopic pregnancy or any other condition may happen. Okay, so you talk about the causes, and when you have to answer the question why it specifically happened in her, in the patient, so you don't exactly know. Okay, and that is what you need to tell her, basically. Okay, so you can tell her that an ectopic pregnancy may have different causes. Okay, in your case, we don't know the exact cause why it happened. Okay, however, any woman of a childbearing age could have an ectopic pregnancy, and a person, a lady, is at an increased risk of having an ectopic pregnancy if she has had a previous ectopic pregnancy before, or she has a damaged fallopian tube. Okay, and when I say damaged fallopian tube, it can have different causes as well. For example, a previous surgery to the fallopian tube. Okay, and even it may even include sterilization procedures. Okay, or it can be a previous infection that may have occurred in the fallopian tubes. Or you have an intrauterine device, a coil inserted, a contraceptive device inserted, and you become pregnant during that when the coil is placed. So even that can lead to ectopic pregnancy. Okay, or sometimes even if you are on the mini pill. You know what a mini pill is? It's a progesterone only contraceptive pill. In few cases, even a mini pill can increase the chances of ectopic pregnancy. And yet in another few ladies, if they have IVF performed on them or ICSI performed on them, they may also end up having ectopic pregnancy. Age is also related to increasing the risk of ectopic pregnancy.